You're Adib with the cism channel. Something we do talk about in the cism model, and we've had many people trained who are mental health professionals. And sometimes people kind of wonder, cism and mental health professionals, do they go hand in hand, or is there a contradiction? I really want to give it up to the mental health professionals who actually have come to many of my trainings and many of my talks. And a couple of times I've been challenged, actually. Mental health professionals are an essential part of this tool. They really contribute to all mental health awesomeness, actually. And we thank them for that. We thank them for their work, their professionalism, their contribution to what they do to many of our people. Now, cism itself, again, I always use the analogy, if the person is driving on the highway and they come across a car accident scene. Well, I'm a surgeon. I don't need to do I do surgery on the side of the highway? Absolutely not. What you do is you stop the bleeding and you stabilize. Same with our mental health professionals. We do not do psychotherapy. We do not do therapy. We are not curing within cism. And cism, all we are doing is stabilizing. This model is a stabilized model. And if they need further help, then we push them on. But at the point of doing cism, we are not doing the therapy. And a lot of people will struggle when we do the cism model because they do tell me that. They say, I want to go to the therapy. I want to find out why is this incident bothering them and why is this crisis? As we talked about earlier about critical incidents, why is this a critical incident? So it kind of creates an interesting dilemma for our mental health professionals and a different challenge, right? And that's really important that they understand that there's the boundary for them and their professionalism, and that the cism model is more of a peer-to-peer based model. And they are a great essential part of this model. We're not dismissing. We're not, whoa, you're a mental health professional. You cannot be a cism peer. Absolutely not. On my team, we have many mental health professionals who are excellent peers, who contribute. Also, what's awesome about that, and again, having them on my members of my team, a lot of times within the cism confidentiality, I can go to them for advice and guidance. I can say, hey, I just talked to somebody. What do you think I should do, or what should... So a lot of times they are an excellent tool to have on your team. So I do encourage mental health professionals to learn what cism is, to join the cism teams, to talk about cism with their members. Just be aware that cism is just first aid. So just like I said, the doctor analogy, I'm a heart surgeon. Well, I'm not personally, but again, I'm a heart surgeon driving on the side of the highway. I don't do heart surgery on the side of the highway. I stabilize, I call the ambulance. I could do heart surgery 5 hours later, but I need my proper tools. I need to be at my clinic. Same with our mental health professionals, our psychiatrists, our psychologists, essential parts of the cism tool, a big part of the reference model and the refer model. But please be aware that there is a difference on the continuum between mental health professionals where they lay, again, first aid, ambulance, emergency room, same with the cism model. Thanks for watching.